Measuring blood pressure. Blood pressure is measured using a device called a sphygmomanometer. And there are three types present today. The first type is the digital one. The second type is the analog. And the third type is the mercury. But in this video, I will show you how to use the digital type. When measuring blood pressure, patient must sit comfortably on a chair in a relaxed position and condition. Any closed that restricts blood flow must be removed. When you're applying the cuff, make sure that the cuff is located directly over the brachial artery, or in simple terms, it is located 1 inch or 2 centimeters from the antecubital area. The cuff must not be too tight or too loose, as you can see in this picture. Once the device has made its calculation, all the data that has been recorded will be displayed on the screen. The information labeled A is the systolic pressure, B is the diastolic pressure, and C is the pulse per minute. When you want to count the radial pulse, you must place the patient's hand on the table with their palm facing the table. Use your first 3 fingers to locate the pulse and exert a little bit pressure when you found it. Don't forget to count using a stopwatch for 1 minute. Record your finding on a note. Afterwards, you may proceed to finish the procedure. In order to count the radial apical pulse, you first must know where is the location where you have to place the diaphragm of the stethoscope. The diaphragm of a stethoscope must be placed on the left mid-clavicular line in the 5th intercostal space. This method requires 2 nurses. One nurse will measure the apical pulse, while the other nurse measures the radial pulse. Therefore, you should ask for assistance.